His Excellency Director Saharatwong Sakuliwat, the Director of the Research and International Cooperation Bureau of the Department of the Disaster Prevention and Mitigation of Thailand, as the Chair of the ASEAN Committee on Disaster Management or ACDM. His Excellency Mr. Thibaut Potvin, the Head of Cooperations of the European Union Delegations to ASEAN, Mr. Lee Yaming, Executive Director of the ASEAN Coordination Center for Humanitarian Assistance on Disaster Management or AHA Center. Distinguished panelists, guests, ladies and gentlemen, welcome to the ASEAN Risk Monitor and Disaster Management Review or ARMOR third edition public launch and webinar. The third edition of the ASEAN Risk Monitor and Disaster Management Review or ARMOR, When Disaster and Pandemic Collide, What Does It Mean to ASEAN Now and Into the Future? Provided well-researched and in-depth analysis of issues relating to disaster management in the ASEAN region. Armor has now established itself as a regular source of knowledge, seeking to share information on innovation and best practices on disaster management and crisis management in one of the most disaster-prone regions in the world. Given the nature of the health crisis endured globally and in the ASEAN region as a result of the COVID-19 in the past years, the contributors in this edition brings highlights to how the current pandemic affected disaster management policymaking. This edition not solely focuses on the COVID-19 pandemic, but also deals with the innovative methods, including the latest information and communication and satellite technology that can be used to speed up the analysis of the real-time data and the cross-border provisions of the aid during disasters in the anticipations of the future pandemics. The third edition of the ASEAN Risk Monitor and Disaster Management Review, or ARMOR, consists of 5 articles. The first is Disaster and Pandemic, the exacerbating effect of the COVID-19 and the ASEAN Disaster Risk Space by the ASEAN Center and Pacific Disaster Center. The second is the Leveraging Artificial Intelligence for Enhanced Flood Emergency Response amid COVID-19 pandemic by the UN Satellite Center or UNOSAT. The third one is the ASEAN Single Window toward more efficient and faster facilitation of the custom clearance by Rifatu Sofia. The fourth, the local as possible, COVID-19 impacts on localization effort of humanitarian response, opportunity for the ASEAN Center by Columbia University. And the last is special feature article on the emergency response in the pandemic, the Singapore COVID-19 experience by the Singapore Civil Defense Force. The AHA Center would like to say thank you to the European Union for the supporting the ARMOR third edition. The AHA Center also would like to say thank you for all distinguished authors, both of the reviewers, both of the editors of the ARMOR third editions, all the commentators for the ARMOR third edition webinar, as well as the attendants. So my colleague will provide the information to download the ARMOR publication in the running text below the screen. Ladies and gentlemen, we would like to start the event by listening the opening speech from the Director Saharat, Director of the Research and International Cooperation Bureau of the Department of Disaster Prevention and Mitigation of Thailand, as the Chair of the ASEAN Committee on Disaster Management, ACDM. His Excellency, the screen is yours.
Head of Cooperation of the EU Delegation to ASEAN, Mr. Thibaut Potvin, Executive Director of the AHA Center, Mr. Lee Yaming, distinguished guests, colleagues, ladies and gentlemen. On behalf of the ACDM family, I am pleased to welcome you to the public launch of the third edition of the ASEAN Risk Monitor and Disaster Management Review, or ARMOR. The ARMOR publication was conceptualized in 2018 as the outlet to share information on ASEAN's region most up-to-date risk profile and trend analysis related to natural disasters and climate risks. We intend to provide this scientific information to inform decision-making and policy development within ASEAN. Through ARMOR, we would also like to showcase to the best practices, trends, and innovations in disaster management in ASEAN, coming from not only the government, but also academic and research institutions, and humanitarian and development organizations from the region and beyond. Ladies and gentlemen, since the conceptualization, we have succeeded to have 2 ARMOR publications and several series of ARMOR webinars, which we hope could be a platform for experts and practitioners to discuss, collaborate, and contribute to ASEAN Vision 2025 on disaster management. And today we are happy to celebrate with you the release of the 3rd edition of the series, taking the theme of disaster and pandemic. This edition features 5 original articles that highlight disaster risk, lessons learned, and innovation that were observed in the ASEAN region during the ongoing pandemic. This edition does not focus only on the current COVID-19 pandemic, but also discusses latest innovations in disaster management, including innovations in information, communication, and satellite technology that can be used to speed up the provision of aid during disasters in anticipation of future pandemics. Today, we will join the discussion between the authors and various experts on key takeaways that we should note from the publication. We are excited to join our panelists of experts coming from the ASEAN member state, European Union, UN agencies, academia, and the AHA Center. Ladies and gentlemen, we envision ARMOR to be more than just a publication, but also a platform for everyone to collaborate and innovate. I hope this can be a start to more discussion and can enable many more creative solutions to improve disaster management in the ASEAN region and even beyond. I would like to commend the work of the AHA Center for successfully creating and facilitating the development of the ARMOR. This would be a step forward for the AHA Center to be an anchor of knowledge hub for disaster management in this region. Last but not least, on behalf of the ACDM Chair, I also would like to express my sincere appreciation to the European Union for continuous support to ASEAN and the ARMOR publication. For the past years, EU has been a very supportive partner for the AHA Center through the EU SAHA project in various knowledge exchange and information sharing. And we would look forward to continue this positive collaboration. Once again, welcome and thank you everyone for joining us today. We invite you to actively contribute to the discussion later, and we hope you enjoy the webinar. Thank you very much.
Thank you, Director Saharat, for the remarks. Moving to the next agenda, so we will listen to the opening remarks by His Excellency Mr. Thibault Poketevang, the head of the cooperations of the European Union delegations to ASEAN. His Excellency, the screen is yours.
Good afternoon. I hope you can hear me well. Mr. Wongsa Kulwiwat, head of the Department of Disaster Prevention and Mitigation from Thailand. Mr. Li Yangming, Executive Director of the AHA Center, all colleagues and partners joining us this afternoon. I'm very glad to join you for the launch of the 3rd edition of the ASEAN Risk Monitor and Disaster Management Review, ARMOR. Many thanks to the AHA Center for the invitation. It's great to see that ARMOR has become a trademark of the ASEAN work on the disasters response, and we should congratulate the AHA Center for this. Unfortunately, the ARMOR publication is also a reminder of the growing risk of disasters and the volatile context in which we live in ASEAN, as well as in Europe and globally. With the COVID pandemic, the accelerating climate crisis, and ongoing concerns on food prices and security, we have too many reminders of the need to build our capacities to respond to disasters. Last May, Indonesia hosted the 7th Global Platform for Disaster Risk Reduction, where leaders from around the world gathered to discuss our response to disasters. The event underlined that current greenhouse gases emission levels far exceed their mitigation, which results in an increase in frequency and intensity of catastrophic events, and that the real cost of disasters is that of inaction. It also underlined that we need to think resilience in all investments and decisions, and to integrate disaster risk reduction and response at the core of development and finance policies, legislations, and plans. With the third edition of Armor, the ASEAN highlights another global risk, pandemics, building on the response to COVID-19 and offering us extremely useful analysis to improve future policymaking on disaster management. The EU is a close partner of the AHA Center and one of the biggest development partners on disaster response. With growing needs around the world, the EU support to partner countries for disaster risk reduction has increased from 10 million euros in 2014 to 845 million euros in 2020. In addition, through our humanitarian budget, the EU also allocates 76 million euros annually to disaster preparedness. I'm glad that the ASEAN region is at the heart of this cooperation. We are actively engaged with the ASEAN through dialogue and sharing of expertise. For example, we participated in August in the meeting of the Joint Disaster Response Plan to support ASEAN efforts to reinforce its collective response in the region and to mobilize resources for response operations. To complement dialogue, our cooperation also mobilizes financial resources. In particular, we provide a grant of 11 million euros to the AHA Center to contribute to the ASEAN Agreement on Disaster Management and Emergency Response, ADMER, to the reduction of disaster losses in the ASEAN member states and to respond to disaster emergencies. We have also allocated 2.2 million euros to share EU expertise on resilience and disaster risk management through the Swedish Civil Contingencies Agencies and the Estonian Rescue Board under the LACER project. Today's webinar is a great illustration of this cooperation, and our support has contributed to the preparation of this new edition of Armor. Armor is particularly useful to share scientific knowledge and experiences gained during the COVID-19 pandemic. It is a guide for actors dealing with disasters management and monitoring, and it's also a tool to bridge science and decision-making. The issues raised in the publication and today's webinar touch upon essential elements of disaster management. I refer, for example, to technology and artificial intelligence to facilitate response to floods, customs clearance mechanisms to accelerate data exchange and cargo clearance, as well as efforts to build response capacities at local level. I am glad that EU expertise contributes to this webinar, for example, to the participation of Dr. Emanuele Raggiu, LACER expert, who will participate as panelist to share experiences from the EU side. The contribution from the LACER project also comes as a follow-up to the risk assessment workshop carried out in September 2021, which brought together experts from the European Commission and the AHA Center to compare the processes of compiling and assessing regional risk across the EU and ASEAN regions. I'm very happy that we can contribute to Armor and to this webinar through our expertise and through our financial support to the AHA Center. I wish you a successful webinar and thank you for your attention.
Thank you, His Excellency, Mr. Thibaut Portavang. So thank you again for the ACDM Chair and the Head of Cooperations of the European Union Delegation to the ASEAN for the opening remarks. Ladies and gentlemen, before we enter to the main event of the Armor 3rd edition public launch and also webinar, and pass it to my colleague Dipo Suma as the moderator of the webinar, we are pleased to present you the Armor 3rd edition's video.
Good afternoon, everyone. I hope you can hear me fine. My name is Dipo Suma. I'm the Resource Mobilization Manager of the IHA Center. I'm pleased to welcome all of you here in our public launch and webinar for the Armor third edition. For your information, the Armor was first published in 2019. The original intention of our publication was actually to bridge science and decision-making process because we want to promote evidence-based policy making. We feel that it's important for us to facilitate the presentation of scientific findings into a language or an article that can be easily understood or can be quickly understood, especially by policymakers and decision makers. And we hope by doing that, we can actually somewhat contribute to the ongoing development of disaster management system in the region, whether individually to the countries or to the region as a whole. So we are very pleased that the Armor is now entering its third publication, and we hope that we can continue the publication years more with the support of different partners, including from the European Union. For the third edition of the Armor, we chose the theme when disasters and pandemic collide. And obviously, everyone here knows that pandemic affects in all facets of life globally, not just in ASEAN, but globally. But particularly for disaster management and emergency response, there is the pandemic actually pushed for a bigger change. And we will discuss these changes in the webinar. Unfortunately, I have 10 minutes to introduce all the teams, as well all the speakers for our discussion today. So I will not waste any time. I will try to do this very quickly. I hope you please bear with me while I'll introduce all the teams and all the speakers. Let me just go quickly. The first article is Disaster and Pandemic, the exacerbating, sorry, my pronunciation, exacerbating effects of COVID-19 on ASEAN disaster risk. This article examines the effects of COVID-19 pandemics and its impact on disaster risk and disaster management and emergency response in the region. This is actually part of our recurring article. So in every edition of Armor, we always present this article, but we updated the data bit by bit, so it reflects the latest situation. The article in particular examined how pandemic worsened the disaster risk of the ASEAN region and how the region adapted its disaster management practices to cope with the pandemic. Second article by our colleagues from UNOSAP, leveraging artificial intelligence for enhanced flood emergency response amid COVID-19 pandemic, tries to illustrate the UN satellites, UNICEF's flood AI program, and how the program can actually provide up-to-date imagery of flood-prone areas. And this is interesting for us because as we experience the pandemic, we noticed that there is some hesitation to deploy teams on the ground. So it's very important for us to continue to improve our remote support. And one of the things we do this is through remote imagery that we can do through the use of AI. So it's a very interesting article. The third article is on ASEAN single windows toward more efficient and faster facilitation of custom clearance. Obviously, an important issue for any disaster management organization and how they can bring in relief items, especially relief items that are not available in the affected countries, faster to the affected community. So the ASEAN single window could be one of the things that can be utilized for us to bring items, relief items, faster into an affected country. The fourth article is on localization with the title As Local as Possible, COVID-19 Impacts on Localization Efforts and Humanitarian Response Opportunities for the IHA Center. So this is an article that is quite specific for the IHA Center. The title itself mentions opportunities for the IHA Center, and we can see during the last 2 years of the pandemic how member states prefer that assistance is deployed within the country. So without requesting international assistance. So localization is very much the key term in the last 2 years, and this and it's an interesting article because it shows how regional organizations such as AHA Center can actually play a role in supporting localization drive from the member states. And the fifth article is also interesting. Actually, all the articles are quite interesting because it showcases the experience of a particular member state, in this case, Singapore, and how they manage their disasters while in the middle of pandemic. The title of the article is Emergency Response in the Pandemic, the Singapore COVID-19 Experience. So those are the 5 articles, and we will begin our discussion shortly. Let's first begin with the article, the first article on disaster and pandemic. This is a collaboration article between PDC, the Pacific Disaster Center based in Hawaii, and the AHA Center. Here in this panel, we have the author from PDC, Dr. Joseph Glynn, who is an expert in the fields of risk information, social vulnerability, health outcomes, and disaster resilience, who has supported numerous humanitarian assistance initiatives in ASEAN since 2019. His background includes over 2 decades of analytical work, a position as a research fellow at the Center for Disease Control, CDC, a doctorate in epidemiology from the State University of New York at Buffalo, and a master in medical geography from the University of South Florida. So we are honored to welcome you here, Dr. Glynn. So let's just begin the conversation. And I think just for the audience information, we prefer to have a kind of conversation rather than presentation. So that's why we discourage the use of PPTs, although it's still possible, but we want to make it like a talk show, basically. So Dr. Glynn, welcome. And let me just quickly ask you what do you think is the key message that you want to convey in this article with regards to the impact of COVID-19 pandemic?
Well, I think there are 3 main overarching points to the article. One, I think you've done a good job in illustrating already, is the use of this ASEAN Risk Index for situational knowledge, or ASEAN Risk, as a way to benchmark member states' risk year over year. So using that as a benchmark to establish member states' risk, disaster risk, and adding new data in year over year. As we saw in our more the second edition, we looked at how climate change influences disaster risk, and now we're looking at how COVID can exacerbate disaster risk. And so I think that's the first key point, that this is a useful exercise year over year to kind of baseline risk and see how it's changing year over year. Secondly, I think the name of the article says it all, that COVID has intensified risk across the ASEAN region. And with that, we also expect that COVID will produce some compounding effects now and in the future. To expand a bit on that, I think we're all very much aware that this is the most disaster-prone region in the world. And during COVID, there was no exception there. During the period of study that we covered during this assessment, I think something of almost 1,700 disasters occurred. That's quite a bit. And that's 48% of all the disasters within the time frame of 2012 to 2021. So that's quite a bit. So what explains that? One would be the better monitoring capabilities of ASEAN member states through the national disaster management organizations, but also the aggregating effects of the pandemic on already existing disaster risk-scape over the region. What it was demonstrated to us through looking through the data is that clearly during the pandemic, disasters don't stop occurring. They just will keep occurring. Therefore, we have this additional exposure of what is essentially a long-term co-occurring hazard. So in addition to all of the other hazards, we have this kind of steady long-term hazard that is occurring. So what that resulted in was an overall increase in disaster risk across the region. In our assessment, this was approximately a 33% increase across member states on average. ASEAN member states who saw the highest number of COVID cases and COVID deaths also saw the largest jump in overall risk. And getting to the compounding effects, as I said, this is a long-term co-occurring disaster for member states. So it's in part somewhat too soon to fully quantify how much that COVID will decrease potentially overall resilience of member states. But it's important to remember when we're discussing that there are a finite number of resources that can be applied to any disaster. Therefore, we can hypothesize now by looking at the data that are presented in the article that the addition of COVID to ASEAN's existing riskscape will have compounding effects by limiting capacity because we just have only so many people, only so much money, and also by potentially increasing the share of the vulnerable population. And another thing, we do have a lot of experience in the region. Member states who are very adept at addressing specific hazard types. But now we have the increased challenge with coping, giving the resources needed to respond to both COVID and the resulting changes in disaster management. And the last point I'd like to make as an epidemiologist, I would like to see better integration of public health and disaster management. Both ultimately serve the same goals of protecting life and reducing suffering of the population. And we should use this as an opportunity for better collaboration between these two disciplines, because what this has shown us is that the pandemic has demonstrated clearly that disaster risk and disaster risk reduction is an interconnected, very complex and evolving system.
Thank you very much, Dr. Lee. Just one follow-up question before I move to either Keith or LA as the other authors. How far do you see the impact of pandemic? Sorry, this is just out of curiosity. Is it going to stay impacting us for the next 2, 3 years, 5 years? Do you see any, cutoff date? Maybe I don't know the better term. When we can say the COVID is no longer affecting us.
Well, I think as COVID moves from pandemic to endemic, I think we will start to see some relief there. But one thing that I've learned with COVID is not to put an end date on it just yet. It is, an ever evolving situation that I think has highlighted the very complex nature of pandemics and disaster riskscape. We're not just talking about an exposure and an outcome here. We're talking about working this in the context of a disaster-prone region with also, the uncertainty of when this may end and what that end will ultimately look like.
Thank you, Dr. Grid. And for the next, the same author for the same article, we have Keith Landicho from the AHA Center. Keith, are you there?
Yeah. Hello.
Good to see you, Keith.
Good to see you.
So Keith is our AHA Center Disaster Monitoring Analysis expert. He holds a Bachelor of Science in Geography and completed academic units in Master of Science in Geomatics Engineering. His experience stems from academic research concerning geographic information system and remote sensing application in hazard assessment, environmental conservation, and urban geography. So welcome, Keith, to the discussion. Let me just quickly ask you, as the author of the article, what do you think has the region learned from COVID-19 pandemic, and how did that change ASEAN member states' policy system and mechanism in managing disasters? Over to you, Keith.
Okay. Thank you, Padipo. So for this question, I think I'll be speaking from experience. I'm positive that both the ASEAN member states as well as ASEAN learned a lot from the COVID-19 pandemic, particularly with managing disasters. So as Dr. Green mentioned a while ago, the truth to the matter is, unlike human activities, that were put on an indefinite halt during the pandemic, disasters continued to impact us. And as the IHA Center monitored disasters in the region, we actually recorded 1,600 disasters for the study period. That's almost 6 disasters occurring daily if we look with that kind of lens. Although a majority of these disasters were within local disaster response capacities, a few required regional coordination and response, particularly Central Vietnam flooding in October 2020 and Typhoon Goni in the Philippines back in November 2020. Normally, we conduct some simple average calculations, but if there has been no adaptation from ASEAN and the member states for their policies, systems, and mechanisms for managing the disasters, uh, it is almost certain that it would have created a snowball effect. So the disasters combined with the COVID-19 pandemic, just making everything worse than it already is. So for our part in the article, to illustrate the changes in the disaster response operations, we surveyed key informants from each national disaster management organization. So, in general, yes, adjustments have been made to varying degrees in the disaster response operations of both the ASEAN member states as well as ASEAN, or particularly the AHA Center. So, to cite some examples, Malaysia and the Philippines, these are the two member states with the highest numbers of COVID-19 cases and deaths. Both of them reported significant changes in their disaster response operations. For the Philippines, as I've mentioned, during Typhoon Goni in the Philippines, they were quick to produce what they call the COVID-19 operational guidance. So for this guidance, it aimed to mitigate infection in evacuation centers, because the situation in evacuation centers, they can be quite packed. They cannot observe COVID-19 health protocols. So in terms of that adaptation by the Philippines, they were quick to produce these operational guidance. And meanwhile, on the part of ASEAN, in the AHA Center, prior to the COVID-19 pandemic, it has been the standard practice to send a team on the ground, like the in-country liaison team or the ERAT, or the Emergency Response and Assessment Team. However, due to the difficulties attached to travel limitations as imposed by the member states and the risk of infection, the AHA Center employed a mixed approach. So, for the case of the Central Vietnam flooding in October 2020, it was a fully virtual coordination of regional assistance, and all levels of coordination with the Vietnam Disaster Management Authority, they were all done online. And in the case of Typhoon Goni in the Philippines in November 2020, we actually have the National Logistics Officer who was already stationed in country. So he was tasked with the operational coordination with the NDRRMC. Moreover, the deployment of the ASEAN ERAT, it was not offered in either case in Vietnam and in the Philippines, because the AHA Center and ASEAN was thinking we want to avoid contributing to the spread of infection across the region. Now, in terms of implementing adjustments, both the NDMOs and the AHA Center reported experiencing challenges. The first one was with logistics. It was the topmost challenge for everyone. Logistics covering movement restrictions, both domestically and internationally, as well as slowed down data collection and reporting. Uh, the combination of the delayed field information to support disaster response decision making and logistical limitations, they resulted in a slowdown of the delivery of relief assistance. However, this was experienced in different degrees in different ASEAN member states. The second one is in terms of resources. Um, for the NDMOs, human resources as well as financial resources, the pandemic and the disasters occurring at the same time affected their resources, both human and financial. I think the last one would be the management of the internally displaced people, because in particular for the Philippines, there was hesitation among affected people in seeking refuge in designated evacuation centers. Of course, this is due to their fears of infection, as reported in some cases in the Philippines and Indonesia. But strict implementation of health protocols, they kind of limited the infection in the evacuation center. So that was kind of a win. And for the last one, the last change, all the ASEAN member states, it was really good to see that they were quick to adapt in terms of information and communications technology. So everyone has sufficient equipment to quickly adapt to the demands of the situation. They were quick to leverage the use of available ICT tools in their departments and in their member states. So what we really saw was the pandemic provided opportunities to adapt with our key disaster response operations as a region and nationally in each respective member state. So despite the challenges, the effectiveness of disaster response was not significantly affected. Moreover, it was an opportune time to show how systems in place suffice, as well as shedding light on the chinks in the armor of the member states. The experience also has pushed ASEAN and the 10 member states to adapt and localize the regional level standard of response. I think that's all for what we have learned during the pandemic with the disasters.
Thank you, Kid. I think that explains a lot. I think in one part you mentioned that if no adjustment has been made, then there's possibility the situation will be worsened. I wonder if it is possible to quantify the different, to compare between if no adjustment and if when adjustment made. Is that a possibility to quantify the difference?
Actually, yes, it is possible, Padipo, because a lot of the data is available. They are made available by both the National Disaster Management Organization and they're made widely publicly available. Of course, these kinds of information, they are a responsibility of the National Disaster Management Organization, and it is on our part, the AHA Center, to look into this information that is available, provide analysis, and see this difference that we can see comparing both before the pandemic and after the pandemic, to see the difference, or if there is any, in terms of key disaster response operations.
Okay. So one more question before I turn to Mr. Emmanuel Raju, and this is either to Dr. Green or to Keith, because I heard that Dr. Green mentioned that there's an increase about 30%, 33% of vulnerability during pandemic, and then also there's the line, I think, in the article that says that in 2021 to 2022, there is an increase to exposure of capital stocks to 6 times of total economies. From before, it was 4 times total economy. So is that the same 33% increase of vulnerability is measured through the exposure of capital stocks, or it's a different thing?
So I'll go ahead and take that first. So the way we looked at that, the exposure is actually separate from the vulnerability. Okay. So the capital stock is just the projected building replacement values that are in the hazard zones per year. And the vulnerability are those socioeconomic factors that have changed since the last assessment, the Armour assessment. So those are things like human capital. We're looking at socioeconomic factors and also health factors as well in this vulnerability.
Okay. So it's a different measurement, but somehow it's converging to almost the same number at 33%. Okay, noted. Thank you very much, Dr. Green and Keith. Let me move to our colleague from the European Union, Mr. Emmanuel Raju, who is currently the director of the Copenhagen Center for Disaster Research Interinstitutional Center, COOP, linking disaster research and education. His research interests include disaster risk education, disaster risk reduction, disaster recovery and governance. He also holds visiting associate professorship at the African Center for Disaster Studies, Northwest University, South Africa. So welcome, Dr. Raju, to the discussion. So just very quickly to ask you, because you're coming here with a lot of experience in the European Union, you might be able to shed some lights and with regards to the impact of COVID-19 pandemics in disaster management context in the European Union. How is it different to the way we experience pandemic here in Southeast, or whether it's the same, or what will be the specific things that you experienced there. So over to you, Dr. Raju.
Thanks, Tipo, and good morning, everyone. I'm also looking at time, how much time I have, Tipo.
I think you can take your time. You're a little bit over schedule, but it's fine.
All right, great, thanks. I think I'll take a slightly different lens to speaking about this, and I think because both Dr. Green and Keith have put some quantitative ways of looking at this, and me particularly being a qualitative researcher, but also here I'm going to talk about from our own experiences, also discussions within the LACER project as well. The pandemic has definitely highlighted a number of challenges, but also a number of opportunities for learning. And I think it's important for me particularly to stress on the fact how we take these lessons forward, so that these lessons are not forgotten, right? And particularly in the context of natural hazards and how we've seen compounding disasters and compounding vulnerabilities. In many places, not just the EU, but across the world, we've seen how it's very often the same communities, the same geographical locations, the vulnerable populations that we speak about are repeatedly impacted by these disasters or have seen worse effects over and over again. So for me, it's important to also stress the fact, how do we talk about vulnerability as a central issue within disaster risk management as we go forward? And that definitely needs to be highlighted. Dr. Green already said this in the fact that COVID has tested not just our systems, but the vulnerability of our systems, of our institutions, and particularly how we continue to say that public health is central to the conversations around disaster risk management, and also within the context of climate. I think we have a number of lessons, particularly in the context of transboundary crises, such as the COVID-19 pandemic and other natural hazards. There's a famous line which says, disasters know no borders. And I think very early on in the pandemic, I think we saw this even within an EU context. We didn't have a lot of answers right at the start, but as we went along the way, I think there was a lot of coordination, lessons for collaboration, all of this that came to the forefront. There are very, very good discussions all throughout around EU solidarity, I think, which need to continue to be at the center of all of this. If we look at the EU, I think going forward, of course, there was a recovery stimulus package that was announced. And I think it's important to stress that this recovery, and there was a lot of discussion, there is a lot of discussion around how this recovery has to focus on a green recovery. How do we discuss the importance of looking at not just the pandemic, but also looking at this in the context of how we're going to make sure that all of these conversations are alive when we speak about issues of climate change and disasters. How do we continue to make sure that disaster risk reduction is an important agenda for policymakers? It needs to be a priority, not just during disasters, but how do we build our systems to be able to prepare better for future disasters? It's about continuing to invest in not just in response mechanisms, but making sure that our preparedness and recovery systems are able to continuously, we monitor, continuously evaluate and update our systems on that scale. The pandemic has definitely highlighted the nature of systemic risks, in the sense that how interconnected a lot of these systems are, how interconnected the world is, how dependent, interdependent we are in this context. And I'm sure a lot of these discussions will also happen at the COP27, which is going to happen very soon. And that's important to remember. Last year, we had a very interesting workshop between the AHA Center and the LACER project on sharing lessons learned and how we communicate risk and risk monitoring. So I think that's opened up a lot of important points for discussion, and I'm sure we'll continue to discuss these issues in that space. Globally, I think there are a couple of lessons that we've learned? How do we make sure that the slogan of leaving no behind continues to be at the center of all discussions for policymakers? And I hope that continues to be at the center of a lot of discussions going forward. Number one. Number two is, let's not forget that if we truly want to achieve disaster risk reduction, we also need to think about the sustainable development goals, because at the end of the day, disaster risk reduction is about making sure we have risk-informed development processes. Thanks, Deepo. I'll stop here for now.
I think they are somewhat converging because when Keith discussed the changes in our system and mechanisms, we saw that the pandemic is not just exposing ourselves to risks or new risks, but it also serves as an opportunity for us to change and start to discuss to put disaster risk reduction as a focus. So not just talking about emergency preparedness and response, but to talk about the whole spectrum of disaster risk reduction. So that's, I think, one of the common thing I get from the three of you, from the three experts here, that it's we have an opportunity. Pandemic has exposed us to a systemic risk, to new vulnerabilities, but it also serves as a way for us to start finding new things. So when we recover, it's not just about recovering from pandemic, but also how the recovery can actually contribute to sustainable development, to addressing climate risk, and these things. So it's not just about pandemic or just about disasters, but how they become integrated with the whole spectrum and other things. So it's very, very interesting that somehow it's converging the discussion. But since time is very limited, so I need to move on to the second article, which is on, let me just read it very quickly, on the use of technology in providing innovative, sorry, it's not the actual article, let me just read that. Leveraging artificial intelligence for enhanced flood emergency response amid COVID-19 pandemic. This is an article written by UNOSAT. There is actually 7 writers in this article, but we only have one representing the team, Mr. Khalid Masfik. I hope I pronounced your name correctly, sir. If I pronounce it wrongly, then just correct me later. He is a disaster risk reduction professional with over 14 years of experience, and is very passionate about applying technology solution for smarter decision making. And obviously, this is one of the things that he is championing. He is currently working as the liaison officer for the United Nations Institute for Training and Research in Bangkok. He holds a master's degree in earthquake engineering. I hope it's not about engineering earthquake, but to address earthquake impact. And also trained on GIS and remote sensing. So welcome to you, sir, to the discussion.
Thank you very much, Deepo, and you pronounced my name very correctly. So listen to that. I hope you can hear me well.
I can hear you very well, sir. Thank you very much for coming.
Okay, thank you.
So let me just get straight into the discussion, because earlier we talked about the impact of pandemic, and here your article actually proposed potential solution. Obviously, because during pandemic it's very difficult for us to deploy a team on the ground to do assessment. So one of the ways we can support member states in the center is for us to do remote support through analysis of maps, remote sensing, and so on. So your article actually talks about a new tool. I hope it can be considered new, Flood AI. Can you explain in simple language what this technology means and how it works? Because it's quite technical. Yeah, I read your article. So please, sir.
Thank you very much, Deepo. And to put it simply, Flood AI is kind of a tool that uses satellite images and automatically generates statistics of flood exposure. And it uses AI algorithm to do so. So what it does, like as we leverage AI for operational use, artificial intelligence, do various analysis satellite images very quickly. So let's say hundreds of satellite images of a flood affected area can be processed within hours. And after processing the image, we can generate the statistics of how many people are exposed in there, how many roads are affected. So it gives us the ability to observe and measure impact remotely. And as you mentioned rightly, during pandemic, it was very challenging to deploy staff to do field damage assessment. And because we observed so raging pandemic in last couple of years, and the floods were happening at the same time. In the previous article, I think it was mentioned, there were 1,600 disasters during the pandemic situation. So what we try to do, we try to find an option that without going to the field, whether we can have an estimate of the impact of the disasters. And luckily what we saw, the estimates came through and the tool is fully operational. And so this is one of the usability we saw. Another usability, it's kind of linked to also the chapter 1, because Dr. Green mentioned that because the pandemic kind of affected our resilience and coping capacity, how we cope with the disasters. So what we try to do in this scenario, we try to juxtapose the information from Health Ministry on the COVID exposure, and we also combine that with the flood exposure to see which communities are under stress. So this is another application that we saw. And finally, one kind of like bit technical apology for that. The data we use for this tool is radar data, meaning we are able to observe the flood situation even during monsoon season when there is lots of cloud. So from satellite, we are able to see even during monsoon season when there is lots of cloud using this technology. So it gives us an upper hand during difficult situation to observe the remote areas and observe the unobservable areas. Over to you, Deepo. Thank you.
Thank you. So it's clear that it can actually produce, it can analyze hundreds of images and then produce a statistic that can be used by responders very quickly. But let me just try to. I wrote it down somewhere here. The question here. But how efficient it is compared to the previous technology? Is it something measurable? 2 hours faster, 3 hours faster, or?
Thank you for this question. Actually, this is the key, because previously we used to use image analysts. Humans were analyzing image by image, and all the teams have their limitation. For example, when we deploy analysts, we have a limited number of image analysts, right? And for one image analyst, it takes few hours to process one satellite image. And when you talk about hundreds, meaning the time to analyze the image will be more than the duration of the flooding. So if information arrives late to AHA Center or any other emergency responding entities in the government, it will be simply not usable, right? So what we saw through the use of this technology, we could reach a scale we thought it was never possible. So for example, we can process hundreds of images within hours. And as you mentioned, it's not just processing the image, but it's also generating the statistics that can be used by responders, like how many people are affected in what community, how many roads are affected, what amount of croplands are affected. So this is automatically done by processing hundreds of images by this algorithm, and is done within hours. And if we wanted to do in traditional method using the human analyst, it would take us months to process these images. So this is where we saw a big opportunity that we can finally provide these vital statistics in a quick time so that it's still usable for the emergency responders. And considering the another point of efficiency is for the analysis, is done on computers. So if we have more and more image, we can simply copy the algorithm and run more images for analysis, which is simply not possible for humans because we cannot copy ourselves and do more analysis. So in this case, the scalability is greater, meaning if we have thousands of images, that is theoretically possible to analyze at the same time as well. And final efficiency, what we realized, it was done through another researcher. So they have tested out all the different algorithms to detect flood from satellite images. And luckily, our algorithm is one of the better ones compared to all other algorithms that is operational during this kind of situation. Over to you, Deepu.
That's so interesting. So just a follow-up question. Have you, because you said that it's quite accurate, the estimation, how did you compare, how do you have any number on the accuracy of the Flood AI? Is it 90% or, sorry, go ahead. Sorry.
Yeah. Thank you. So this is another area I would like to focus, because this algorithm needs a bit of training, because not all the area of the world are same, and one algorithm cannot detect everything. So I am very pleased to inform you, our algorithm has been tested in 4 countries of ASEAN region. So it works in Myanmar, Laos, Cambodia, Vietnam, and we are also currently testing in Thailand. So in the future, our algorithm will be reliably working in most of the ASEAN countries. And the accuracy numbers we are getting for every country, it comes a bit different, but we are kind of getting around 90% plus accuracy in most of the cases. But there are caveats, because in certain cases, there are hilly areas, there are urban areas where satellite sensors cannot detect properly. But on an average, we are getting very high accuracy numbers, close to 90 or 90 plus. And we are fully ready to support all the ASEAN member states with this operational tool during monsoon season.
Okay, thank you for that. And I guess because you mentioned, the article also mentioned that it's using a deep learning system, meaning that the more you apply it, the better the AI will, adjust its accuracy.
Exactly. So that's what we are trying to do now. We are trying to work with the governments directly, and also agencies like you, AHA Center, to input more information. For example, if some area our model is underperforming, we have the possibility to work with the government agencies to correct mistakes and provide more training to the algorithm. So in the future, it achieves reasonable accuracy that can be used by all the National Disaster Management Office. So that's where I think there is a room for collaboration, and we need feedback from the end users in terms of saying, your model is good here, it's not good there. So we look to increase our collaboration through our center in terms of applicability of this tool, and also improving the accuracy of the tool in the near future. Thank you.
Thank you, Sir Khalid. And I think now we need to move to the other article, but please stay, Sir Khalid, while we are discussing the other article, which is on the ASEAN single window, authored by our colleague Rifatus Sophia. Miss Sophia. How are you, Sophie?
I'm good, Pak Dipo. Long time no see.
Sophie is our preparedness and response officer in the center. She has over 7 years of experience in disaster management, and she was involved in a number of things in the ASEAN Center, including planning, implementation of projects, facilitating trainings, capacity building program, as well as reporting on projects and management of response operations. She is also a trained ASEAN Emergency Response and Assessment Team member. So welcome, Sophie. And I think just want to say that the article is very interesting on ASEAN single window. Obviously, especially during pandemic, I think Keith mentioned one of the challenges in managing response operations during pandemic is logistic, how to make sure items can arrive on time. And your article talks about ASEAN single window, so it's basically discussing how the CIQ, custom, immigration, and quarantine procedures in ASEAN member states can be improved to support faster acceptance of international assistance. So just very quickly, I have a question for you. The ASEAN single window, whether this has been implemented in ASEAN, and at this current format, has it covered the mobilization of relief items into a particular country? Over to you, Sophie.
Thank you very much, Pak Dipo, and very good afternoon, everyone. Again, thank you for the opportunity for this afternoon. Talking about the ASEAN single window, is basically a regional established initiative that aims to facilitate the exchange of data and informations between ASEAN member states for trade facilitation. So it allows national single windows from the national system from the ASEAN member state to synchronize the data exchange across the border to expedite and streamline the clearance and shipments released in the region. But basically, currently, it has been used for the facilitation for trade, particularly trade facilitation in some ASEAN member states. But in the context of humanitarian assistance, it hasn't implemented yet. However, through this paper, actually, we try to analyze how this initiative can bring an added value for the humanitarian assistance, particularly in times of emergency and amidst the pandemic.
So just to clarify, at its current format, it's mostly used for trade, but it's never
For
been
trade
utilized to basically facilitate humanitarian assistance.
Correct.
And in your view, and I think you also put this in your article, how can the ASEAN single window could actually help, fasten the mobilization of assistance? What kind of issues that it can help address?
Yeah. So back to the backgrounds problems, that one of the main challenges for getting relief assistance to the affected communities quickly is the processing time of the custom clearance for the humanitarian relief items, as well as immigration clearance, particularly for the personnel. So different ASEAN member states might have a variety of structures, processes, requirements, and such a mechanism for custom clearance, quarantine, something like that. But particularly, additionally, as the influence of the COVID-19 pandemics, there are some also protocols or restrictions affecting the cross-border movement for the humanitarians or perhaps a cargo, even the personnel in response to the COVID pandemics. So the challenges or delays of the facilitations caused by various problems, but one of the critical variables highlight for the delays of the custom and clearance approval process is the backlog in incoming relief assistance. Backlog is defined as the an amount of the relief consignment coming into the point of entry that is waiting to be processed, particularly for the custom approval process. So we can imagine that during disaster, there will be many backlogs, and when the backlogs growing large, the consignment keep coming, then it might take some time to process the backlogs approval. In addition to that, another critical variables of custom delay is basically time to verify the paperwork to obtain the approval from different agencies. So the approval and verifications need to be streamlined and communicated with the relevant agencies, and it might also takes time with the numbers of the stakeholders involved and the requirement of paperwork, which is currently mostly still done conventionally, such as conducting review here and then back to back the approval. So it might also increase the time needed to track the responses. So to overcome these bottlenecks in custom facilitations, particularly during the disaster, as well as to harmonize the regional mechanism, there is a need to streamline all of the processes with the use of the technology. Referring to previous speakers and the panelists, that this pandemic actually brings an opportunity, particularly for this, the technology, to enhance our preparedness and response, particularly here is on the area of humanitarian logistics. So by having the application of ASEAN single window, this is to focus on the simplifying and automate the custom processes. So it will enable the rapid tracking as well as the paperless, contactless of the facilitation, which is urgently needed, particularly amidst this pandemic and as well as later on in the future emergencies. As this, Pak Dipo and also others, it has some potential benefits. For example, first is the less contact and paperless, which is the submission of documents electronically can reduce contact between the involved party, such as government officials, perhaps the other entities. So these approaches can minimize the risk of the spread of the COVID-19. While the online approach by using the technology, it also allows the faster procedures that fast the steps, particularly compared to the conventional or manual processes. For example, if we refers to the facilitation of trade by using the manual approach, it might perhaps takes 3 or 5 days, even 1 week. However, if we utilize the electronic platform, this single windows, as it will be streamlined the data exchange, so it will take less than a minute to synchronize the data. And then the electronic exchange, it's also ensure the data or information's transparency or better compliance with the guidelines, specification and conditions, which might also imposed by the assisting entity in the midst or in the context of humanitarian assistance. Of course, it is also better and efficient in terms of record keeping, easier access to relevant parties, and then this actually pre-arrival informations that receive electronically can be also as an what you call it, as an a way to, you know, to overcome the backlogs that usually happens during the disaster. And basically the last point, it's actually it's already, the initiative is already established. However, it is still needs such kind of discussions later on, whether this with some previous potential benefits, how can this you know, help or up applied in the humanitarians, particularly in facilitating humanitarian assistance. Like that, Pak Dipo, perhaps.
Thank you very much, Sophie. I think that's a great idea. I think we can immediately see the potential benefits, but there could be some challenges in implementing this, especially because it is under a different sector. So it's not under disaster management sector. It's still under. If it is for trade, then most likely it's under the economic pillar of ASEAN. So there could be some, challenges in getting cross-pillar collaboration, something like this. So, but it's a very good idea. I think we should keep this in mind. And while we are thinking about this, let me introduce you to the commenter of these two articles, Dr. Mizan Misri. I hope he's here.
Yes.
Hi, Pak Mizan.
Thank you, Pak Dipo. Hi. Hi, Khalid. Pak Sophie.
I see you are connecting from an outdoor space.
Yes. This is in Kobe. That's a building.
Pak Mizan is our former colleague here in the AHA Center, but now he is an assistant professor at the Graduate School of International Cooperation Studies, Kobe University, Japan. So he's connecting with us from Kobe. He's also the founder of CariBencana.id, a search engine for risk and resilience, an end-to-end web-based disaster knowledge management platform powered by a lot of technological terms, powered by spatial analytics and machine learning to harvest multiple knowledge bases. So welcome, Pak Mizan, to the discussion. So let me just quickly get your response to both articles. Maybe first you can comment on the Flood AI article. In your view, how do you envision this technology to be a solution for an effective response? Could you give us, another example on how AI can potentially be used to help emergency response operations? So over to you, Pak Mizan.
Yes, thank you very much, Pak Dipo. And first of all, of course, congratulations to my dear friend here, Khalid, and also UNOSAT colleagues with this very important progress and also advancement in terms of the AI utilization for flood analysis and also to provide a better and more cleaner operational picture that can support the emergency response operation on the ground. And what is important is that it has already battle tested in some of the ASEAN member states. So this is clearly an advancement in comparison to the discussion about remote sensing, satellite-based observation to support emergency response that occurred 4 or 5 years ago. So, of course, the natural question, since I was also part of the discussion in this area a couple of years ago, is, of course, just out of curiosity, Mr. Khalid, how the current Flood AI then already interface with the existing platform or initiatives under the Asia Pacific Regional Forum on the satellite observation, and also with colleagues or mechanisms under Sentinel Asia, for instance. But of course, as I mentioned earlier, this is a clear advancement, and this is up to AHA Center, up to ASEAN as a regional body, and also up to the ASEAN member states to leverage and also take benefit from this important technological advancement. However, I think we could further enhance the use case story of these applications, the Flood AI within the region, and also to highlight the user experience, the decision maker experience in these 4 countries that Khalid just mentioned, how it actually give values to the operation, what kind of difference it's already made on the ground, let's say what kind of decisions at the end of the day it can support, or how the emergency commander or those in the emergency operation center in some of the case load that Khalid just mentioned and wrote in the article, at the end of the day makes difference on the ground. And also at the end of the day, it's about strategic and also tactical interface with the specific ASEAN vis-a-vis AHA Center digital assets. I'm not sure whether this advancement also already in the pipeline of the ASEAN UN Joint Strategic Plan of Action on Disaster Management. But I think naturally I can find or I can identify already some of the existing points, identified working relations between UN agencies and also ASEAN bodies within these thematic areas. And of course, naturally, with this kind of advancement, it's about upscaling. It's about the actual interface with some of the digital assets and decision support system within ASEAN system. So again, this is our food for thought with Dr. Green, with colleagues at the Disaster Monitoring and Analysis Unit of the AHA Center. How then the output of the Flood AI can be tapped in, and where? Is it to DMRS? Is it to ADINET 2.0? Is it to Web EOC of ASEAN that also already have a feature for spatial analysis and also mapping? So where the bits and pieces is already there, and in terms of technologies, it's continuously advancing. So it's up to us as human, as the decision maker, to leverage on that. And also at the operational level, supposedly now that Flood AI also will be one of the key tools that AHA Center in normal times, in preparedness times, will use. Then what does it mean for the emergency action planning within the AHA Center protocol? Which kind of decision can be supported using this Flood AI? Is it about the exposure estimation? To what extent it will inform the planning of the resource mobilization? I think this is one of the area that, of course, we can always work together to further enhance the usefulness of this kind of application. Of course, as Khalid and colleagues already demonstrated, it's already useful to further provide a more detailed exposure data and information. So, of course, it's up to AHA Center to make use of that to have a better resource planning in terms of estimating humanitarian needs and so on and so forth. And lastly, of course, at the strategic point of view, ASEAN already have the ICT roadmap 2025 and beyond. But also, I would like to recall the result of the ASEAN EOC's interconnectivity study, and also the level of digital disaster risk reduction maturity model of ASEAN countries, which was produced last year, whereby it stated that despite of various technological advancements, the homework is about capacity building across levels, from strategic level to operational and tactical level, and also to really create an operational program that at the end of the day can make use of the technological advancement such as that demonstrated by UNOSAT and colleagues. I will stop there first, Pak Dipo.
I think those are very penetrating insight. Thank you very much, Pak Bizan, for the comments. I'm not sure whether Khalid, do you want to respond to some of the questions? I think some of them are, I don't know whether this is possible to address here, like interface with other platforms, for example, Sentinel Asia, whether this is already part of the ASEAN UN Joint Strategic Plan of Action on Disaster Management, and also a highlight on user experience, highlight on the experience of decision maker, how this actually affects decision making process. Although I'm not sure whether it's been, because I think it's just been piloted, so I don't know whether it's being used to support decision making. But over to you, Sir Masfik, for the response.
Thank you very much. And the questions really go into the business. Because data and information is not useful unless it's presented in the way decision makers need it, right? And to put it simply, because we don't have a lot of time now, to put it simply, this is where we need help of AHA Center. We have the tool. We are generating statistics with our kind of understanding of the user, right? And our understanding is kind of global understanding. So as we work with this tool in Southeast Asia, in South Asia, and we are also applying this tool in Africa. So our understanding is not fine-tuned to the region. So this is exactly where we would need support of an agency like AHA Center for us to understand how we can fine-tune our user experience. And in cases how we can inject our data into existing decision-making system. So we already generate data, so it's a matter of understanding how we can plug ourselves in the existing systems, so we don't create any parallel information mechanism. And that has been the challenge. Integration has to be the key going forward. So I think we need to discuss more, and we need to find a way to look at these both things: user experience and also the integration of information in certain unified platform that is already existing. So fully in agreement, and I think this is just the start. We have to walk a long mile before to make it fully useful for all the decision makers in the region. Thank you. Deepo, I think you are muted.
Oh, sorry. I was just praising you and Mizan for the discussion, the penetrating questions from Mizan, and I think hopefully in the future we can have follow up bilateral discussion between us and UNOSAT on this. So just to continue on the discussion, also again back to Pamizan, on your view on the article on ASEAN single window, how do you think its usefulness in terms of mobilizing relief assistance, and what would be, in your view, because you have a deep understanding of the ASEAN Center's role and mandate, what do you think will be our potential role, ASEAN Center potential role in mobilizing relief assistance using this single window? Over to you, Pak Mizan.
Thank you, Pak Dipo, for the question, and also Ibu Sofia for the article. Obviously, the progress in the ASEAN single window is potentially useful, but it largely depends on the interface between the economic and also the socio-cultural pillars and the relevant sectors within each pillar within the ASEAN system. The ASEAN single window protocol is very young, and naturally, if we look into the main protocol documents and also the supplementary documents, the word disaster, disaster risk, humanitarian, or humanitarian assistance are not part of the vocabulary. So the introduction from the sectoral bodies from disaster management is very crucial. As we discussed, it is intended for trade facilitation, and there is no clear distinguish in terms of the protocol in normal and emergency situation. So again, of course, there is a progress, but there are still room for improvement. And the key factors to make this progress in ASEAN single window can be useful for the economic pillar and also the socio-cultural pillar of ASEAN is about the dissemination of the disaster management protocols, outreach, familiarization, and also institutionalization of this national single window and ASEAN single window within ASEAN member states and the national single window itself, and to ensure the institutionalization of the ASEAN single window as part of the CIQP procedures during disaster and emergency response operation. So what does it mean? Of course, it means about what does it mean to the adjustment of the SASOP, and what kind of form, whether the SASOP itself will be digitalized, and if it's being digitalized, will it be piggyback through the ASEAN single windows protocols and also web-based system or not, and so on. It could also even better, in my opinion, if the national single window and also the ASEAN single window protocol already tailored, and I'm not sure whether this is already a part of that or not, where if it is tailored to the items under the good classification catalog. As we know, each member state also have their own goods and services classification bureau. So it is even better if the data set, the database in terms of the goods and services already integrated, already have in the form of e-catalog, that at the end of the day, it can even be useful if the ASEAN Joint Disaster Response Plan modules can look into these goods and services classification catalog, which if we have this good database and can piggyback on the ASEAN single window. So what AHA Center can do, or what ACDM can do, I think it's important to note that the ASEAN Single Window Protocol, specifically Article 4, mentioned that it is about regulating to facilitate trade, flow of goods, especially goods, between government and businesses, businesses to businesses, government to government, and others. So there is a room for the others. Of course, as we know, in terms of disaster, there are lots of assistance between government to government within ASEAN. So what about the others? So this is, I think, the role of AHA Center to have some experimentation, to put some thought piece about how humanitarians in ASEAN can leverage or can use the ASEAN single window. And whether in terms of utilization of ASEAN single window, AHA Center will be the interface on behalf of the humanitarian communities. This is a question. Of course, this is an open question that can be followed up after this launching event. So at the tactical level, what AHA Center can do is outreach to relevant bodies, regulators, and players who are making use of this ASEAN single window, and help NDMO to reach out to the in-country regulator and players or user who are using the national single window, to also introduce the overall ASEAN disaster management architecture in normal and emergencies time, and find strategic, operational, and also tactical leverage that can connect with the national single window and ASEAN single window. Even perhaps invite the ASEAN single window steering committee to the either tabletop exercise, CPX, or FTX under the brand of ARDEX or other venue to simulate or to showcase the difference of this custom processing through the ASEAN single window. How fast and how fast and how reliable the border clearance, the quarantine would be under the ASEAN single window. And this can also be a demonstration to the NDMO, to the humanitarians in our region. And ultimately, ASEAN as a whole and also AHA Center, in my opinion, can learn from a similar process at the global level. As you know, within the main document of the ASEAN Single Window Protocol, there are several key references to the revised Kyoto Convention and also the World Customs Organization. Well, guess what? The World Customs Organization, or WCO, in the past, with UN OCHA, WFP, WHO, WHO, IFRC, and also the Global Logistic Cluster, have attempted what they call WCO CRED project, which is a pivotal project after the adoption of the resolution on the role of customs in natural disaster relief, and was tested in several disasters and epidemic cases in Africa. Well, perhaps some of the lessons learned, either it's positive or negative in terms of the interface between these two subject matter, customs, clearance, trade, and so on, with disaster management, humanitarian, can be harvested for actual application within ASEAN system. AHA Center, ACDM should, in my opinion, and could start the conversation with the ASEAN Single Window Steering Committee in the near future. Again, within the ADMER Work Program 2021-2025, AHA Center Work Plan, I don't think there is a specific text referring to the ASEAN Single Window and the or identifying ASEAN Single Window Steering Committee as one of the key actors, but I think the hook can be found, and this is again one of the low-hanging fruit that can be pursued by the ASEAN, by AHA Center, ACDM, ASEAN bodies, and if we can show it properly, perhaps we can also become a reference for other regional organizations and mechanisms. Thank you very much, Pak Dipo, Pak Bu Sophie.
Thank you, Pak Mizan. Again, a very insightful comment, and I think we agree that this is because this is not under the same pillar of disaster management. This is under a different pillar, so that requires a lot of consultation, discussions, testing. But the benefit is there. I think there's a potential for faster response if we can achieve it. Using ASEAN Single Window for to mobilize relief assistance. So we will see the development. But again, thank you for the insightful comment, and also to Sophie for the article. And because we are a little bit behind schedule. Let me move to the next article, and this is the final group of article. One article is coming from, it's on the localization project. Talks about, the title of the article is As Local as Possible, COVID-19 Impacts on Localization Efforts and Humanitarian Response, Opportunities for the AHA Center. Unfortunately, we were not able to secure the speakers because the authors are graduate students from, I think, Columbia University. And I think most of them have graduated, so it's very difficult to reach out to them. But as a replacement, because AHA Center was also involved in the research, so we get one of the AHA Center staff to present the results of the study. I think it's Caroline Widakdo, our Knowledge and Change Management Officer, who will present the results. So go ahead, Carol. The floor is yours.
So as yes. As mentioned, this article was authored by our colleagues from School of International and Public Affairs of Columbia University, with support from the Center for Excellence in Disaster Management and Humanitarian Assistance in Hawaii in 2021. So basically, the study was conducted last year, and our SIPA colleagues transformed the result of the study into the article, which is now featured in Armor. And as the basis of the study, they conducted a series of cross-sectional examination of various experts' opinions across humanitarian actors, also conducted semi-structured interviews to seek ASEAN member states and international organizations' perspectives on their understanding about localization. And you'll find in the article discussion on definition of localization, which is important for ASEAN to define before we ensure how can we leverage it as a tool to support ASEAN's emergency response. And from the multi-interpretation of the concept, the article, the study resulted in a working definition of localization in ASEAN region as a process of recognizing, respecting, and strengthening the independence of leadership and decision-making of local actors in humanitarian and disaster response. And the study also explained how local actors, including national actors, subnational actors, local authorities, communities, and CSOs can be engaged in the localization process. In the article, they also discuss essential roles of the AHA Center. What can regional institutions like the AHA Center do to support localization? And they attributed the AHA Center as having an essential role in coordination and providing visibility to regional and national actors through various practice, among others, capacity buildings, partnerships, and coordinations. And at the end of the discussion, they also provide recommendations on how the ASEAN as a region and the ASEAN member states, including the AHA Center, can adapt localization to support humanitarian response. That includes how the AHA Center can support amplifying youth participation to incorporate societal change and empowerment in the at the local level. They mentioned that youth can be one of the entry point to promote youth participation in the disaster management, and how the ASEAN member states can connect with the youth to promote the understanding and importance of localization and local empowerment. They also mentioned the importance of identifying areas where government can localize assistance and support national organizations. One of the examples presented in the article is the Philippines case, where they establish disaster risk reduction councils at different government levels, from barangay to national levels. They also mentioned about centralizing platforms for information sharing. This will be a potential role for the AHA Center to facilitate knowledge exchange through various networks, understanding that although local actors may have developed their skills to respond to disaster through experience, but some may also rely to scenarios and information exchanges so they can improve their capacity. So that's in essence what's presented in this article. You may access and read the details in the Armor publication. Thank you, Mas Dipo.
Thank you, Carol. And the article was actually very interesting to, especially to the Center, not only because the Center is the subject of the article, but because it also provides us with a general understanding of what localization means. As you know, that different organizations may understand localization differently, but the article actually provides us with a solid background how we should understand localization and how we can move forward with the localization efforts. And there's also an ongoing discussion between internationalization, regionalization, and localization, and how we can position the three concepts. Obviously, it's still important to have an international assistance, but empowering local capacity is also very important because a number of reasons. One, when disaster happens, it's always the local community that giving the first response. They are the first responders. So if the local community is empowered, then the community is becoming resilient. So those are things that are we think is very important, and we hope that if you have the time, although the authors are not here, you can have a look at the articles and see what that means, and maybe you can take a lesson or two from the article. So let's move on to the final article, last but not least, representing one of our member states from Singapore. We have, I believe we have all five authors. Hi.
Hello.
Good to see all of you here.
Hi, Bani. We have only three of us here today. Pierre and CD are unable to make it. Thanks for having us here today. I'm Amelia, and I have with me Azhar.
Hello.
And also Hui
Hello,
Ting.
Azhar.
Hello,
Hi.
Dipo.
Let me just quickly read your CV, not CV, but a bit of background. I know Amelia and Azhar, but I think it's first time I met Ang Hui Ting. But good to see all of you. Muhammad Azhar bin Asaid is a graduate of our ACE program. ACE program is AHA Center Executive Program, and a member of the ASEAN Emergency Response and Assessment Team, ASEAN ERAT. He is a current commander of a fire station in with the Singapore Civil Defense Force, and he's also a member of the Disaster and Rescue Team, DART. He has been professionally trained in various skills, which include firefighting, rescue, hazardous materials, incident command, training and safety, and resource management. So welcome, Azhar. And Amelia Justina Lim has been with the Singapore Civil Defense Force for 13 years and has gone through both frontline and management posting as an emergency paramedic, Rota commander, and staff officer managing the emergency medical services. Currently, she is also a fire station commander. She is also an alumnus of the AHA Center Executive Program, Batch 6, and a member of the ASEAN ERAT. Ang Hui Ting, I hope I pronounce your name correctly, but if I'm pronounce it correctly, please just correct me. Has served with the SCDF for 8 years and has gone through various posting in frontline response, policy planning in hazardous materials, and fire station management. She is a hazmat specialist and currently the assistant director for risk management and review. So welcome, three of you. And this article is a special article because it talks about the actual experience of our member states in managing response during pandemic. So let me just get straight to the question, if I can find it here. Okay, the question is, how far is the adjustment taken? Sorry, it's maybe just give me 3 minutes.
Yep, sure.
Okay, no issue.
Okay, my apology. I think I have to explain it a little bit. We have a building announcement. I think it's. I'm standing next to the building speaker, so that's why it's quite loud. I don't want to disturb the discussion. My apology for taking the, I think, 2 minutes break.
It's okay.
Sorry. So let's just go back to the discussion. My question is, with regards to the article, how far is the adjustment taken by the Singapore Civil Defense Force to ensure operational readiness in pandemic setting?
Okay, thank you for the question. I think to set the context, because we are the agency that is managing the emergency response for the country in terms of fire, rescue, and also medical services. So as the national agency managing this, we really cannot afford to disrupt our business, because that means disrupting the service to the public. So all the adjustment that we took during the pandemic, all the kind of different practices that we undertook during the pandemic is really to maintain operational readiness, to make sure that we can still continue to operate, because we can't have our frontliners working from home, for example. That's just not possible. Yeah, but at the same time, while doing that, we are also exposing our frontliners to the risk of the pandemic itself. So we took a lot of steps to make sure that we have the protection for our frontliners, and not only the frontliners, but also the support workers, the people in the officers in the headquarters, and so the division headquarters, because the frontliners cannot operate without them as well. So we make sure that we adhere to the national guidelines set up by the Ministry of Health. And a lot of times we even go some steps beyond that, because being an essential service, we have to be a little bit more strict to make sure that we are safe, we can operate safely. And it was quite challenging, because I think the challenges as the pandemic evolves also evolve by itself. For example, at the beginning, the challenge is probably about more about uncertainty, as we learn more and more about the pandemic, what we are dealing with, and how we can operate safely. And then after that, it was the increased call load, because our emergency ambulances are seeing more emergency calls, emergency medical calls from the public. Sometimes it may or may not be COVID-related calls. It may be just a normal day-to-day call, but somehow after the pandemic, it's just getting more. And in the long term, we are also facing a risk of burnout among the frontliners, because it's been such a protracted crisis in a sense. Yeah, so the question is how far? So I guess we really do what we can to make sure that we are operationally ready, because we really, as I mentioned, we really cannot afford to have our service disrupted. But at the same time, we are mindful of the impact that it gives to our responders as well. So we need to make sure that we can balance both sides. Any comments from the rest?
Maybe you can also elaborate on some of the mitigation measures that you undertook. Like I think you mentioned in the article, PPEs is a must for all the frontliner responders. What other mitigation measures you undertook during pandemic?
Yeah, so again, we adhere to the national guidelines. So other than providing the PPE, the correct level of PPE for the responders who may be facing the people with suspected COVID cases themselves, but we also employ strategies such as grouping of the workers. So we have, for example, in one office or in one fire station, we have a group A and group B people, so that if someone in one group is infected by COVID, then group B can still operate. So we always make sure that we have this kind of redundancy. And other than that, we institute things like safe distancing measures in the fire station. Of course, we enforce mask wearing. So it has been very, very difficult. So we limit social activity. So in the past, maybe we used to have dinner together with the whole office people or the whole fire station people, but we couldn't do that during the COVID. So it has been quite a lot of sacrifice from all the responders. Vaccination, we made sure that we kept up with our vaccination. So I think that's also another strategy.
What about just to explore a little bit further, what about the use of technology, for example, for tracing? I think you touched a little bit on one of your mitigation measures was to institute a tracing system. Do you use a lot of technology for tracing, or is this something that you do, organically? Basically, people can just report when a case happens.
Yeah, so we tap on the application that was rolled out by the government. It's called a Trace Together. Yeah, so it's basically it launched by Bluetooth. Actually, I think this is not exactly unique. I think I saw this also in Indonesia, also in I think Malaysia also. So whenever we enter certain places, we have to use our phone and make a scan, and the application also can sort of detect if there are if let's say you've been to a place where subsequently someone near you was subsequently diagnosed with COVID, then you will get an alert on your phone, and then they'll tell you to visit maybe a testing center or just monitor your health depending on the level of exposure. So we tap on this. So we institute that in the fire station also. Other than that, things like temperature monitoring. At some point of time, we also had very rigorous testing. So before every duty, all the responders have to take the rapid test, and they have to make sure that they are negative before they can actually report to work. Yeah, so at some point of time. So depending on the stage of the pandemic, I would say how the strategies was involved differs.
Thank you. So after 2 years of adjusting your operational readiness, not operational readiness, but the way you respond to any crisis in Singapore, is there any particular lessons learned or new insights that you gain from the last 2 years?
I think the use of technology has been very significant. Yeah, other than the operational part of it, things our training and also meetings when we just like what we are doing now, we turn to virtual mode, and we realize that actually we can do this. We don't really need to have everybody to be physically in place to be able to do something. So that makes the way we work more efficient, I would say, and we explore. I think the pandemic somehow accelerated this transition to a more technology-based way of working. Maybe that's one of the lessons that we learned. And the other thing also is the importance of caring for our staff. I mean, of course, it's important, but when we are faced with such a long crisis, I think the focus on mental health and also welfare and upkeeping the morale of the frontliners is very important. So that came to the highlight during this pandemic. Yeah, we did. I think quite glad to say that we had some very important lessons that we learned from the outbreak of SARS in 2003. So that's when we learned that we should have a stockpile of PPE for ready to be deployed for any pandemic. So that helped us a lot, and that made us much more ready for this pandemic as compared to the last.
Adding on to that, Dipo, having learned from the SARS experience in, I think, 2003, we all can agree that there's no two disasters that are the same, but there is not really a necessity for us to approach this in a totally different manner altogether. So, for example, one is for sure that in all disaster we need to have good, strong, and trusted leaders to set the tone, set the pace, and make changes to whatever process that we are going to change later on, right? And next is, I think we also have, with all the changes that is implemented and all the new protocols that is put in place, we also, as the ground executing it, we must also be able to be flexible and to be able to stand our ground and to follow strictly the protocols that is being cascaded down, so that, because we are dealing with a lot of people in distress, so we really have to stand our ground on that. So so that's number 2. Number 3, I think Amelia just mentioned earlier, we must have our readily available stockpile, which can be pushed down to the front line as fast as possible. All right. And I think the last one that we learned from the SARS experience was the business continuity plan. I think that one we must have multiple layers of defense that should be put in place so as not to disrupt the business continuity plan. So I think in my opinion, the business continuity plan, the level of line of defense should start from the individual level, team level, agencies, ministry, and if I can summarize it in a short sentence, it should be the whole of government approach in mitigating on the pandemic. So that's our SCDF approach in short.
Thank you, Azhar and Amelia. I think that's those are very useful lessons learned. I take note the utilization of, there's a bigger utilization of technology. There's actually the opportunity to, accelerate transformation into more technology-based work. There is a greater emphasis on caring for the human, the people. There is also a focus on mental health, moral support. I also take note on the importance of having a good, trusted and strong leadership, to help us in finding new directions, especially because it's a time of uncertainty. So it's very important for a leader to, give some sort of, firm grounding on what we are and where we are going, despite all this, confusion. I also take note with interest, there's the seemingly contradictory point that you made, Azhar, on flexibility and strictly following protocols. So this seems to be quite contradicting, but I cannot understand. Maybe you can explain this better, not better, but a little bit more later. There is also the importance of having available stockpile that can be pushed immediately upon to support the frontliners, and that. Sorry, I think I lost connection for a while. I hope you get my points. I mentioned the business continuity plan for the last point. So maybe just to go back to you, Azhar, on the importance on flexibility and strictly following protocol. Can you elaborate a little bit more on that?
Okay, flexibility is we as the frontliners, when we are so used to. Hello, are you able to hear me? Hello.
Hello.
Testing. I think I lost connection.
We can hear you, Dipo.
Yes, now I can hear.
Yeah. Okay.
Okay. So just to make it clear. Okay, because we are so used to a certain protocol in peacetime scenario. So come to a pandemic in this, at the pandemic time, there's a lot of changes made, and we have to be able to adapt to the changes and to the new protocols set in place. All right. So, but however, because this is not the norm that we have been practicing, all the citizens have been practicing all this while. Okay. So, for example, if I can quote you just one example. If an ambulance is responding to a AG plus case, and they have some previous records in a certain hospital, and they want our ambulance to send them to that particular hospital, we might not be able to do so because there's a certain protocol, there's a certain limit to the hospital capacity that they can accept care. So if sometimes with this kind of situation, they might not understand why we make this kind of decision. The citizen might not be able to understand. So we must stand firm on our ground. Look, this is our new protocol. We have to adhere to it. And sometimes it can cause a little bit of conflict with the patient. And that is where we have to, I'm saying that we have to stand our ground and follow the protocol strictly. So yeah, we have to adhere to the new protocol that is set by the higher ministry. So if I can just make it clearer.
I think that's very good. Thank you, Azhar. I think that means a flexibility within, the space that is given to us, and that space is limited by, the protocol. So I think that makes sense very much. Now I think we are a little bit over time, but I would like to quickly invite our commenter, Mr. Bambang Suryaputra. Is Pak Bambang here? From BNPB Indonesia.
Yes.
BNPB
Hello, Pak Dipo.
is the National Disaster Management Agency of Indonesia. Hello, Pak Bambang. Good to see you, Pak.
Good to see you too. And hello, everyone.
Good to see you, sir. Welcome. Pak Bambang is the Director of the Emergency Operations Center, or Pusdal Ops in Indonesia, of the BNPB. So Pak Bambang here to maybe give some insights on perspective from another member states, in this case Indonesia. I will just go straight to the question, Pak Bambang, if you're okay.
Okay.
Hello, Pak.
Yes, sure. Can you hear me clear?
Okay.
Hello.
So I think connection is a little bit choppy.
Yeah, maybe in Pak Dipo.
Ken, it's the connection that is the problem, I guess. Yeah. Okay. So let's just go straight to because Pak Bambang, we just heard the experience from Singapore, but maybe you can also share some experience from Indonesia, especially when it comes to responding to disasters during pandemic. I think during the pandemic, we knew that there were several disaster events happening in Indonesia. There is the earthquake in Mamuju, and then there's the tropical cyclone Seroja. There's the volcano eruption Semeru erupted, and then another earthquake in West Sumatra. So there's a lot of disaster, because disaster actually, I don't think they understand there's a pandemic happening, so they keep happening. So can you share your experience, Pak, in managing response operations and pandemic also happening at the same time? Over to you, Pak Bambang.
Yeah, of course, there's some challenges to face when there is disasters happen in the pandemic era, like in these recent 2 years. Yeah, as we all know, mostly in ASEAN countries is like a laboratorium of disasters. Especially in Indonesia, we have 3 or 4 disasters happen every day. Which is sometimes there will be some IDPs also there. So it is really challenging for us, because we have to prepare at least twice evacuation places in the, like for example, before maybe we only have 2 times 3 meters for 1 IDPs. Now we have to set up twice a lot of space to prevent for distancing, for these IDPs. This is one challenge, and the other is for volunteers itself, because many volunteers come from other places which is far away, or from cities, which is the cases is quite high. So we need to protect the disaster if it is happening in the very remote place. which is no cases of COVID at all. So we have to protect the IDPs not to get the COVID. So that's why for volunteers we have to test them and protect them, and we have to make sure that those volunteers is already vaccinated. And the others is we have to prepare like maskers and a place for hand washing and like a disinfecting, and also disinfecting the evacuation places frequently to prevent from COVID, and many more. And sometimes also the IDPs itself, which is it is in the area, it is spread a lot of COVID at that area. It is like in the red zone, like in the East Java. So we have to make sure that all frontliners and also volunteers is already vaccinated, like they already have a second or boosters vaccinated, to make sure that they will be very well, and also how to be so to protect them, to use a masker when in the field. And there are some challenges also. It is similar with our colleague in Singapore, because our call centers also flooded with the request of support for the COVID, because you use the two call centers in disaster. One is 991, especially for health supporting, and then also 117 for especially for field supporting for disaster. So when there is a over flooding in the 119, so that will automatically goes to the 117. This is also our challenge, because we have to add more operators to handle the case of disaster in the same time with the COVID.
Thank you, Pak. So there's a lot of adjustment, starting from having more evacuation places to accommodate safe distancing, to regularly test volunteers, provide them with vaccination, PPEs, disinfectant, making sure that there's actually a lot of things done. Can you share with us? I think there's a report somewhere that even though pandemic is happening, the rate of infection in evacuation places is actually quite low because of the way BNPB managed this disaster. Can you explain a little bit about this, whether this is correct, or whether BNPB actually track the infection rate in evacuation places?
Yeah, the hardest thing is to for the self distancing. It is one is something that very hard to handle. The second is usually for the hydrometeorological disaster, it is not so easy to make people use masker disciplinely, because it is it is rain, and it is easily to be wet, and it is not so easy to make the stock on the field to keep the stock in the very good condition. So it is sometimes it is very hard, and that's why you are right in the area in the disaster happened. But it is originally because of before there are some number of cases in that area. If it is not, sometimes it is also happen in the area which is green, or there is no cases there. So we usually have to protect for disaster workers like volunteers, frontliners together should be negative because it is a green area. But if it is in the cases where there is in that area is already have some cases. So usually it is slowly, but it is getting high because the problem of the protection, the problem of the how to make distance, and the problem of how to make the discipline to use of the masker or to hand washing and something like that.
Okay, thank you very much, Pak Bambang, for the insightful sharing of experience. I think it's very much noted. Obviously, there's a lot of happening in Indonesia. So pandemic, no pandemic, disaster will continue. So that's a fact. And thank you very much for sharing the experience and how you can, basically manage the pandemic, even though manage the disaster, even though pandemic is happening. Colleagues, unfortunately, the time is up. I think we are over by 13 minutes already. So in the original plan, we are supposed to do a live poll through Mentimeter, but I think we have to skip that and go straight to the conclusion. I managed to capture some notes. I hope that I can summarize the discussion well. If I miss anything, I hope later on we will have a report of the event. So maybe the more accurate discussion will be captured in that report, hopefully. But just very quickly to summarize, starting from the first discussion on the first article by Dr. Green and our colleagues from the Center, where they utilize the ASEAN Risk Index to measure the resilience level of the ASEAN countries as a whole, as a region, and they found that there is actually an increase in there's a decrease in our capacity to to manage disasters. I think the term will be the resilience index is decreasing, and this could be accounted from the pandemic. So the pandemic is the additional risk that actually increase our exposure to risk. And there's a number of key points that we can capture here. The first one, lessons learned, I think. The first one is there's a need to have a better integration of public health system with disaster management, because it's not a separate thing. So we, especially during the pandemic, we realized that public health is a major issue that should be taken into account. They also mentioned that the fact that pandemic is also a chance for us to learn. It's actually an opportunity for us to improve our disaster management system. There was a discussion where the point is not just using the pandemic as an opportunity to discuss issues bigger than disaster management. So, for example, when we talk about recovery, we're not just talking about recovery from disasters or recovery from pandemic, but also how recovery can actually, the recovery efforts can actually contribute to other things. For example, how it can contribute to our fight against climate change. How we can put DRR as the main focus. How we can actually improve our disaster management system, and so on. So it's actually an opportunity for us to improve our response. Also, how it can also contribute to sustainable development. So those are the things that we can learn from the first discussion. On the second article on Flood AI, the Flood AI is an innovative tool developed by UNOSAP, where they can process hundreds of satellite images in a matter of hours, turning it into statistics that can be utilized by emergency responders on the ground. So the tool has been tested in 4 countries, and now I think it's ongoing in Thailand, and it shows that a faster ability to analyze images in a matter of hours with accuracy level close to 90%. We also discussed that the more we utilize this tool, the more that the system can actually learn from itself, and then becoming more accurate in the future. We are also talking about the possibility of scaling this up into the region. So how AHA Center can benefit from the utilization of the Flat AI tool. So that's the third, the second article. And then we also talk about the ASEAN single window. And here we talk about the potential of using an existing system in ASEAN. The ASEAN single window is an initiative from the economic pillar, especially from the trade sector, to enable a faster, smoother exchange of goods for trade. But the article discussed the possibility of utilizing the system to enhance or to improve the way we manage incoming international assistance, especially coming from fellow ASEAN member states. It can help address a backlog of international incoming assistance. It can also shorten verification time. It can also simplify and automate our custom clearance process. So a lot of benefits, but at the same time, there's also a challenge of how we can implement this, because this is not coming from the disaster management sector. This is actually an initiative by the trade sector. So there's a lot of discussion, outreach that will need to take place before we can fully implement this system. We also discussed the article on localization. Unfortunately, the authors are not able to join us, but the localization article provides some insight on potential roles that AHA Center can play in supporting the empowerment of local organization as well as the national disaster management system. So it was a very interesting article. Maybe one day in the future we can get them to come, and then we can also discuss this with you. The final article concerns the experience from the member states in managing disasters during pandemic. The experience from the Singapore Civil Defense Force, where they need to make a number of adjustments to ensure operational readiness. And I think the authors already mentioned that they are frontliners, and you can call them as part of the essential services that cannot stop even when pandemic happens. So they need to be operationally ready at any time. And some of the adjustment they made use heavy reliance on technology. They also implement a tracing system, a grouping of workers where ensuring a redundancy of workers basically. So when one group is in those posts, then the other group can take place and can take over and then play the role as necessary. They also mention some of the important lessons learned from pandemic, including a greater focus on mental health of the officers, the importance of having a good and strong leadership to provide them with some groundings and certainty in the uncertain times, to be flexible while at the same time still following the established protocol, to have a stockpile ready to be able to go at the moment notice, and then to have a business continuity plan. We also heard the experience from Indonesia in managing their disasters and emergency response. There's a lot of challenges, especially because in the last 2 years, there's actually some significant disasters happening in Indonesia. But BNPB implemented some steps, including preparing for double evacuation places. They actually have more evacuation places so that it allows for a more social distancing in evacuation places. They also make sure that the volunteers are protected, including regularly testing them, providing them with vaccination, as well as PPEs. So these are the all the summary of discussion that I managed to capture. I think it tells the story of the different adjustment that we made, the different lessons that we capture, and how eventually despite the challenge that was set on us, I think somehow we managed to find a way to adjust and then to actually improve. But I think one of the lessons also that we capture from the discussion is the importance of continue moving forward, seeing ahead, and not stopping at the current status, but actually to keep adjusting for the future. So it's not a finished process; it's actually a continuing process, and we hope maybe in the 2 years, 3 years time, then we will see another things, further adjustment, further improvement to be made. Thank you, everyone, and we are really, really sorry for going over time, but we are happy to have all of you here, and we hope to see you again in other events organized by the HAS Center. With this, I'll close my moderation, and I'll hand it over to the organizer. So, Carol or the MC, over to you.
So thank you so much, the moderator, for today. So we learned a lot from the ASEAN Risk Monitor and Disaster Management Review of Armor 3. Once again, we would like to remind you, you can access the Armor 3rd edition on the ahascenter.org/armor. So ladies and gentlemen, this is the final one. And I would like to thank for all of the panelists for today. So we conclude this as the end of the session. So please stay healthy and see you in another chance. Bye.